There's another global health crisis at play in South Africa. Health officials have confirmed recording 5 cases of the MPox virus with 1 death in Gauteng. While the virus is not as transmissible as COVID-19, it severely impacts patients with immunodeficiencies. Our reporter Karinda Jagmohan attended the briefing by health officials in Pretoria and joins me now live there with the details. Karinda, thank you so much for your time this afternoon. Just give us the latest that came out of that update that you went to for that media briefing.
Certainly, Masa. So with 5 cases of the MPox virus, the department says this is an outbreak in South Africa, and we asked why it was considered an outbreak. When you consider these 5 cases are among the over 97,000 globally recorded since 2022. Those 5 cases emerged in South Africa in eThekwini as well as Gauteng just this year, with sadly 1 person passing away at the Tembisa hospital just this week. But the department raised the fact that this virus, the MPox disease, specifically or severely infects patients or impacts patients with low immunodeficiency or with immunodeficiency, something sadly widespread in the country when you look at the state of the spread of HIV and AIDS. But first, take a listen to the minister just giving a breakdown of the cases currently in the country.
In the current outbreak, we have recorded 5 laboratory confirmed cases. And regrettably, 1 of those have passed away. 2 of these cases were confirmed in Gauteng and 3 in KwaZulu-Natal. The death that occurred is amongst the 2 cases in Gauteng. This patient passed away late on Monday this week, Monday the 10th of June in Tembisa Hospital. All cases and all the patients are males aged between 30 and 39 years without any travel history to other countries which are experiencing outbreaks.
Now, the MPox virus originally began with animal to human transmission. The first human case was recorded in 1970 in the DRC, which currently has the highest number in terms of the outbreak. But that strain of the MPox virus is not the same strain we're seeing in terms of the multi-country outbreak. Currently, this strain is presenting as severe flu symptoms, but with a rash or itchiness similar to chickenpox, but with that flu symptoms. What we have heard from researchers here is that there are specific groups that are showing more symptoms of this virus or highly transmissible to this virus. And with regards to the treatment now, there's a general antiviral treatment, but vaccinations at this point, for South Africa at least, has not been approved by SAFRA. So going forward, what has happened is the Department of Health has obtained an emergency approval by SAFRA, just looking at the numbers currently in the country and wanting to not prevent further spread of this. So those emergency vaccinations will be procured in terms of donations from the World Health Organization, from countries that currently have additional vaccinations to share essentially. So while these vaccinations are being shared with specific populations, at the same time there's also a move to try and limit the number of cases over the next 2 years worldwide. Take a listen to the minister speaking about the critical treatment.
Although it's not registered with our South African Health Product Regulatory Authority, SAPRA, the Department of Health has obtained from SAPRA an emergency use approval, which is called a Section 21 approval for compassionate use for patients with severe disease. So that has been obtained.
Now, these vaccinations, once procured, the minister says at least within this month, will be handed out to specific groups at this time, similar to what we saw to COVID-19, which, by the way, the MPox virus is not as transmissible as COVID-19 in terms of this requires skin-to-skin contact. So this vaccination will be given to healthcare workers, sex workers, and men who have sex with other men. We raised a question why this was, and it was really just looking at the research, and the patients have come out explaining who they've had contact with and in what ways, showing the skin-to-skin transmissible virus, and also with regards to how this virus spreads through skin lesions as well. So this is one of the main groups that came up, but at the same time, the department has stressed that there should not be a stigma created around this, just to ensure that those who may believe that they have this virus in terms of the symptoms presenting will be able to be confident to get the treatment required, especially considering that if one does have immunodeficiency diseases, they could severely be impacted, as was tragically the person who succumbed to MPox at the Tembisa hospital early this week. The department will give ongoing updates. They also did speak about the severe flu outbreak. Currently, they said that there's no signal that this might be something more. It is likened to the winter flu virus, apologies, that is more common during this time of the year, and then also just pressed on for citizens to just keep watch on the NICD health stats as we have over the past years.
Karinda, thank you so much for that report and giving us more clarity on those people who have contracted MPox. That's 5 cases, 2 in Gauteng and the rest in eThekwini, with 1 fatality so far. We'll keep a close eye on that.